of life is good and try to make them live longer and see if they would qualify for any of the advances in the field like LVADs, transplant and other stuff. And we at Heart Center here do LVADs and offer other advanced treatments in congestive heart failure.
Now that we're facing the COVID epidemic, we've been in the middle of this for quite a while now. I know that you're seeing patients who are scared. You're also seeing patients coming in with lots of comorbid conditions that have potentially put off coming in until later on because they're scared of coming to the doctor's office. They're scared of coming to the hospital. What are you seeing, and then what are you telling these patients and your staff and your practice? What are they telling these patients that are scared to come to the hospital? They're scared to come into the doctor's office to see you. What reassurances are you and your staff giving them?
I mean, COVID has always been an eye-opener and game changer for all of us. So there's something which has become new norm, but what we are trying to do is make sure our patients are safe and make sure that their issues are met with. So in that way, we are trying to do multiple things to help our patients, like televisits, phone calls to the patients. And we are also, even in the offices and in the other clinics where we go, we try to make sure there's minimal interaction for the patients, whether it's be in the waiting room, or we try to room them into their rooms straight away, and everyone is made sure that everyone has a mask on. So in that way, we're taking all the precautions so that the risk of any transmission of COVID, at least during this visit to the office or clinic, is extremely low.
So we talked about those patients that are still scared to come in, they're still hesitant. You know, you're hearing stories from across the country and stories in our own area where patients have been having chest pains for days and weeks, but yet they've delayed in seeking care, they've delayed in coming to the emergency room. What advice would you give those patients about making sure they seek treatment sooner rather than later?
It is an unfortunate thing, but it is a reality that a lot of patients are seeking care later than what they are supposed to be. And that's been a big challenge from the medical community to address and try to reassure the patients that we are taking all the necessary precautions to take care of them. If they have any issues, they should definitely contact us. And if there is something which we can do as a televisit, we would be more than happy to offer the televisit. But in some situations, televisit is not the right thing for the patient, and then we try to make sure, see them at the earliest, even try to do a walk-in if needed and take care of their issues.
What are some early signs and symptoms that patients could be looking for if they think they might be experiencing some cardiac trouble?
Predominantly in heart failure patients or in heart disease patients, the symptoms you're watching for, any new onset symptoms of chest pain, shortness of breath, anything which has changed all of a sudden in the last week, those are the symptoms which we are watching for. And most of our heart failure patients know that if there is any weight gain and if it hasn't responded to oral diuretics, that's when they have to come into the office to take care. And most of our CAD patients know that if there is any new onset symptoms of chest pain or shortness of breath, they are supposed to come in. Unfortunately, there has been a trend where we are seeing sometimes, especially in the newer patients, when they have this chest pains, they try to dismiss it or don't want to go to the ER because of this concern about COVID. And sometimes because of that delay in care, sometimes unfortunate things do happen.
So we've all heard about wearing a mask and social distancing, limiting our, groups of people, avoiding large crowds, things like that. So from your perspective, from a physician's perspective, can you tell us what are some of the things that we can do to prevent the spread of COVID in our own area, in our own community?
Excellent question. COVID is a viral and a respiratory illness. So the most important things is, which we already know, but we have to practice them, which is social distancing, using a mask, hand washing. These are the most important things. The moment you step out of the house, you need to wear a mask. That's the most important thing which you can do so that you can minimize the chance of you getting an infection from someone or minimize the chance of you giving that infection to someone else. And also, people who are at high risk should not venture out unless it is absolutely needed. And the other thing which you want to make sure is avoid big gatherings. And the other thing important is anyone who can work from home should work from home. The essential workers who cannot work from home are the ones who are supposed to go with taking all the above precautions which I mentioned.
I know we're hearing a lot in the news about vaccines that are being developed, different ones that are under investigation, numerous companies that are working on these. I know they've started clinical trials on a number of different types of vaccines. What does that vaccine scenario look like right now?
Excellent question, Amy. Regarding the vaccine, currently there are multiple vaccines across the world which are being developed, and there are multiple of them in the later part of the trials, which is phase 3 trials, which generally will take at least several more months to complete. And there are some other vaccines which are in phase 2, which will take a longer period of time. The main purpose of the vaccine trials is to make sure that it is safe and it can be given to all the healthy people, and it produces the enough immunity which they are looking for, so that we can all be protected for this COVID situation.
So I know that there are a lot of people out there that are scared to take a new vaccine when it first becomes available. Being in the healthcare industry like I am and like you are, we will more than likely be some of the first ones that will be required to take this vaccine. So talk to me and talk to those people that are scared about taking a new vaccine when it first comes out.
I understand the skepticism about taking something which comes new, but one thing you have to remember is for a vaccine or for any medication to come out, it goes through multiple trials, and a lot of people had it and they were followed up to make sure it is safe and effective before it is given to common population, common public. So if I were you, I would definitely take it, and once the vaccine comes, I'm happy to take it. And if you still have concerns, we as your healthcare providers, we are more than happy to answer your questions and alleviate your fears.
When you're facing cancer, you want a winning team on your side, or even better, two. That's why Northeast Georgia Medical Center is now an affiliate of the Winship Cancer Institute of Emory University, a new collaboration that gives you access to more treatment options and promising clinical trials, all at convenient locations that keep you safe and close to home. Northeast Georgia Medical Center, now an affiliate of Winship at Emory. More voices, more victories.
Welcome back, Dr. Kamari. Again, thanks for taking time to talk to us today. So our main audience today are people ages 50 and up, and a lot of them are concerned about what's going on with COVID. We've already talked about COVID. Some of the challenges that we seem to be facing in the community and with my family and with your family is that folks aren't able to see their relatives. The older folks aren't able to see their grandkids. They aren't able to see their kids. What effects are you seeing on those folks as far as stress and mental health issues? What kind of effects is that having on the people who are 50 and above?
That's an excellent question, Amy. Regarding stress and mental health on cardiac issues, it has always been shown that stress increases a lot of issues in terms of health and especially cardiac issues. I understand COVID is a different scenario, and we, being social beings, not having interaction with other people is a very stressful thing. But I think we should do what we can in terms of minimizing the stress, whether it be meditation, trying to Skype or Zoom with your family, going for walks, or keep yourself engaged with other things. And if you have a closed loop where you're not going outside, like two families or one or two people where you can trust, you can possibly interact with them with appropriate social distancing and masks and other stuff.
So Dr. Kamari, speaking from my own experience, my parents are in their 70s. They're missing seeing their grandkids. They're missing seeing me, their daughter. So we're doing as much, visiting by FaceTime and phone calls and different things like that. And I'm wondering if this is something you're seeing in your patient population as well. And then what are some additional things we can do to try to ease that stress of that older population that may be missing seeing their families?
That's a great question, Amy. Especially with older people, the biggest concern is they're not able to meet their family in person, which is causing them a lot of issues, mainly because of for their mental well-being. What I would suggest, on top of doing the Skype, the phone calls, you can still meet outside with like drive-through visits where you're maintaining appropriate distance and not touching each other, using all the masks and other stuff, so that you're still having the interaction. We as a family, we are trying to do in my household, that's what we are doing, is we're spending more time with the kids, going on walks and biking and all the other things, and the kids are talking to their grandparents via Skype and all the other different media.
Talk about how important it is for folks, especially those 50 and above, to continue on with their regular yearly checkups, those mammograms, those annual blood tests, blood pressure checks, all of those things that they would normally do in a year when there's not COVID. Talk about how important it is for those folks to continue those preventative visits and those preventative screenings.
With regarding to following up with your regular doctors as well as keeping up with your annual physicals and other stuff, it is very important to do that, because a lot of times things get picked up at those visits, and sometimes picking up those things early will make a big difference between life and death or outcomes in a lot of people. So I would still suggest that you keep up with your regular visits and get your testing done as needed, and try to do televisits in situations where it is possible, and your physician will be able to advise you accordingly whether this is something they can do televisit, or whether they should still see you in person based upon your condition and your situation.
Dr. Kamuri, the question that nobody wants to ask, but we're going to ask it. What if I get COVID? I wake up, I've got a runny nose, I've got a fever, I can't decide, is it allergies, is it, I don't know, but I go get tested and the result comes back and I'm positive. Where do I go from there?
The common symptoms you're seeing are fever, cough, cold, something like any other upper respiratory tract infection, sometimes loss of smell, and occasionally GI symptoms like vomitings and diarrhea. If you've been around people who had COVID, and also with the community transmission, which means people who did not have symptoms could still be transmitting COVID. If there is any new symptoms like these, you should rightfully suspect about COVID and get the testing done. You can always talk to your primary care doctor, who will refer you to the appropriate center where they can get the COVID testing done. And remember, getting COVID doesn't mean it's a death sentence. Most of the people recover. It's people who are at high risk, people with older and people with multiple medical issues who are at high risk. The key is to treat it early and seek medical advice early, so that the physicians can determine whether you need to be on steroids, whether you need oxygen support, or whether you need more advanced treatments.
So Dr. Kamuri, thank you so much for taking time to talk to us today. I'm so thankful you could be here and talk to me and this great group of folks that are attending the Generations Expo. We're so glad you could be here today.
Sure.
Dr. Kamuri is one of the cardiologists with the Heart Center of Northeast Georgia Medical Center. He sees patients in the Braselton and Buford offices, and if you need a cardiologist, he would love to see you. If you'd like to make an appointment, please feel free to call our office at 770-534-2020. Thank you.
Thank you, Dr. Kamuri. I'd like to take a minute to thank the folks making today's presentations possible, including our presenting sponsor, Northeast Georgia Health System, as well as our supporting sponsors and preferred vendors, including Denison Hearing Solutions, Royal Blue Medical, Fernbank Museum of Natural History, the City of Lawrenceville, Gwinnett County Communications, Advanced Urology, Aurora Theater, Belk Mall of Georgia, the Gwinnett Stripers, and Levin Florist. Before our next presentation, please watch this message from one of our supporting sponsors and preferred vendor, Fernbank Museum of Natural History. Did you know that Fernbank has 75 acres of new outdoor nature adventures? Wildwoods and Fernbank Forest combine to highlight the natural world through immersive trails, educational programming, hands-on exhibits, and beautiful scenery. A great place for a relaxing walk. Check it out.
Discover a world of wow at Fernbank. From indoor museum experiences to 75 acres of outdoor fun. Discover nature's thrill ride as you explore a dramatic canopy walk, incredible tree pods, playful nature exhibits, amazing wildlife, and 2 miles of trails winding through an immersive old-growth forest. Fernbank, where the greatest show is Earth. Get tickets at fernbankmuseum.org.
Now I'd like to introduce William Dennison, founder of Dennison Hearing Solutions. Will is nationally board certified in the hearing instrument sciences, along with a Bachelor of Science and a Master of Arts from Georgia College and State University in Milledgeville. Dennison is also the only tinnitus care provider certified by the International Hearing Society in the state of Georgia. Please welcome Will Dennison.
Thank you, Will. This is Will Dennison with Dennison Hearing Solutions. For most people, hearing loss is not an inability to hear as much as an inability to understand. You hear someone talking, but it may come across as muffled or mumbled. You might hear the beginning of a sentence, but lose the end of it. You might think people are speaking too fast or not speaking clearly enough. These are all indicators that something might be going on with your hearing. When sound hits our eardrum, it goes through a process and eventually ends up moving millions of hair-like cells in our cochlea, which then transmit signal to our brain. Over time, these cells become worn out from use, and it takes a louder stimulus to excite them. Imagine walking from the front door to the mailbox each day. Over time, you eventually wear a path through the grass. This is what happens as sound passes over those cells, and why the more birthdays we get, the more likely we are to have some difficulty with our hearing. In fact, by the age of 65, a third of the population has some level of hearing loss. Too often, I hear patients say they hear fine for their age. When we choose to ignore our hearing loss, or just accept it without treatment, we're not only doing a disservice to ourselves, but to our loved ones as well. Untreated hearing loss does damage to our brains and to our relationships, which is why I tell each of my patients that hearing health is whole health. You cannot live a completely healthy life and ignore difficulty with your hearing. Today, I want to take a few minutes to discuss one example of how hearing can impact other areas of our health, specifically our cognitive health. When we hear, our brains are taking different sounds and putting them together in a way that makes sense, kind of like putting together a jigsaw puzzle. As we begin to lose our hearing, some of those puzzle pieces are being taken away from us. You might hear part of a word, but you have to guess at the rest of it. Context and visual cues can help with this, but it's still a guessing game. Did they say yoga or yogurt? Pearl or girl? This guessing game puts additional stress on our brain that can impact us in many ways. For one, this can lead to cognitive overload. If your brain is working harder to understand what's being said, it does not have as many resources available for processing or remembering. It can be an exhausting exercise trying to follow a conversation when you have a hearing loss. In fact, many of my patients have reported that they have more energy at the end of the day after they begin wearing hearing aids for the first time. This is just one way that hearing impacts our overall well-being, and why doctors recommend anyone over the age of 55 incorporate a hearing checkup into their annual wellness plans. So when was your last hearing checkup? Dennison Hearing Solutions offers the most comprehensive evaluation and consultation around, and it's one of the reasons we have been voted Best in Gwinnett each year that we've been open. Our complete evaluation is usually $125. However, for everyone attending the Generations Expo, we are going to offer you the full evaluation at no charge. But please call today, because this offer will expire at the end of the month and space is limited. Also, we are following CDC guidelines to ensure a safe environment for you at the time of your visit.
Cameras.
Rolling.
Rolling. Middle 17, take 7, action.
Now here's a song of mine that Reba McEntire almost recorded. It's called Pieces of My Heart. How many pieces of my heart did I give to you?
Okay, Mama.
How many times can I cut you back
All right, I'll tell you.
and not call myself a fool?
What? Where? The beauty for you? Oh, no, don't.
How many pieces of my heart did I give to you?
Now, Lombardo, stop. Because I know if I even try.
I'm asking you to join me in being a team player for a healthier Gwinnett. As a team, we can stop the spread of COVID-19.
Welcome back. According to the CDC, about 140,000 Americans die each year from strokes. Did you know that the nation's highest death rates from stroke are in the southeastern United States? Do you know the signs of a stroke? Our next guest, Tina Johnson, stroke coordinator at Northeast Georgia Medical Center Barrow, will share important information about identifying the early signs of a stroke.
We're speaking with you today about May being Stroke Awareness Month in the United States. Stroke occurs approximately every 40 seconds in the United States, and this equates to about 795,000 stroke patients per year. Unfortunately, 140,000 of those patients will also die from their stroke. Northeast Georgia Health System would like to make sure that everyone understands the signs and symptoms of a stroke and understands the need to activate 911 emergency services if they see these symptoms. One of the acronyms that we use is called Be Fast. With this acronym, B stands for an acute loss of balance. You're no longer able to stand up appropriately. When you look at the E, that stands for eyes, and that means that you've had a loss of vision or maybe a sudden onset of blurred vision.
F stands for face, any sudden onset of facial drooping or numbness. A stands for arms, any sudden onset of arm weakness or numbness. S stands for speech, any sudden onset of difficulty speaking, such as slurring your words, not being able to speak, or simply hard to understand. T stands for time. It's time to call 911. If you have these symptoms or recognize them in someone else, it's time to call 911 immediately, even if the symptoms improve.
By using Be Fast, you can help ensure rapid stroke treatment. When it comes to stroke, every second counts, and rapid treatment can help improve survival and reduce the disability after stroke. Our emergency departments and inpatient stroke units stand ready to provide stroke care every single day, no matter what the world looks like. During this pandemic, we want you to know you are safe coming to Northeast Georgia Medical Center for stroke care. We are prepared to take care of you and your family when you need us.
This year has been tough on all of us. Your loved ones in your household have been more important than ever. Sometimes the simple things and an easier pace of life provides us with perspective on our values. Time with our family, meals together, moments well spent with the ones we love.
Welcome back to the September 17th edition of Generations Expo virtual event, sponsored by Northeast Georgia Health System. I'm Will Hammock with the Gwinnett Daily Post. Our next guest is from the recently opened Royal Blue Medical Center in Lawrenceville. Welcome nurse practitioner Laquan James.
Hi, my name is Laquan James. I'm a nurse practitioner. I did get a nursing and biology degree, came to Georgia, and I started working in the ER as a nurse in the ICU and ER. So what got me into healthcare was my grandmother had diabetes when I was a kid, and I always kept her compliant with her insulin because I wanted to do it every time. So, and also another thing that really got me into healthcare was I saw a lot of homeless people. And when I was young, I was like, gosh, I wish I could help them. I wish I could help them. And so that really is what got me into healthcare today. I want to be the one that is the sole culprit for that person being healthy or living again. So that's why I became a nurse practitioner, because I'm given that opportunity to be the head of that person's healthcare and take the full advantage of getting them back to 100% as best I can. So how did I become a part of the Royal Blue family? I really want to help people in more ways than one. Like, I don't want a patient to have to go to a primary care doctor for something that I can help them with here. And so their vision and their sincerity and how they presented it to me is how I became a part of this family, because they believe in what I believe in, and that's getting patients as healthy as possible in more ways than one. So what sets Royal Blue apart from other practices that are similar? It has to be our communication, the way we are a family, the way we greet our patients when they come in. They feel like it's not a doctor's visit. They feel like they can just come in and have a conversation. So I do have a lot of experience in mental health and substance abuse. So I have a natural background of wanting to get to know my patients. It's not just about coming in to get an injection, just coming in to get a procedure. It's more than just a doctor's visit. So some of the main practices that we do is we use hyaluronic acid to inject into the joints with people who have osteoarthritis. It can be done in the shoulder as well as the knee. Insurance pays for it, so we have a lot of patients that have osteoarthritis who don't want surgery. Well, this is a way to actually prevent that from happening and give you some increased function and decrease in pain. And if that doesn't work, we do a service called platelet-rich plasma, which is when we draw your blood and we spin that and we inject that into the affected joint, which can also aid in a decrease in inflammation, an increase in function, and overall well-being. And it's all completely natural with no side effects. So with that platelet-rich plasma, we can inject that into any area of the body where there's inflammation, and that platelet-rich plasma finds the source of inflammation and treats it. And so we do aesthetics with it, we do injections with it, we do vampire facials with it. There's a lot of different things you can do with it, as well as treat erectile dysfunction and urinary incontinence for women. We also do hormone replacement with Bio-T pellets. It's bioidentical pellets, which we can help to decrease depression. I've had patients come off of antidepressants, increase your energy, decrease joint pain, decrease cardiovascular disease and breast cancer and uterine cancer. It can also improve your sleep. And also, of course, what we all want is to increase your libido. So it can do that as well. We have a lot of different practices that we have here that we can use to treat the whole patient. And it's not just one thing, but we offer a lot. A one-stop shop, and you love our environment, you will love us, so you will come back to see us anyway. Are we up to date on the latest technology? Yes, we are, because I am a nerd. I believe in, once I treat someone, I want to be able to tell them why, which is with research, what I read, so they know that they're getting the best care possible. We're giving them the best cream of the crop care. They don't have to worry about going anywhere else. All their questions will always be answered, and we treat everyone the way they should be treated. Is there any equipment that sets us apart from any other practice? We have what's called an orthoscan machine, and what that does is, as we're injecting into the joint, and I let them see when I put in the dye where I'm injecting the hyaluronic acid or the PRP, so they can see, okay, this doctor or physician knows what they're doing. I can see myself that they are in that joint. I can see how bad my knees are, and I didn't know that. And so they will get the full benefit of seeing what I'm doing to educate even other people that needs these services. So how has COVID affected our practice? Much like any other practice, a lot of the older generation are affected by different types of osteoarthritis or arthritic pain, but they don't feel safe when they go into a doctor's office. But I would tell you from personal experience, I did have COVID, yes, and I do understand your concern. However, when a patient does come in, we do have, we check their temperatures. We also assess to make sure they're not sick. They wear a mask as well as the provider or the injector. And so we try to do everything as best we can, and we abide by the CDC guidelines as far as what you should do when a patient comes in. So what can I tell the patients who may be delaying their procedures that they may need who are at home? Well, I say it just like this. From having my own personal experiences with COVID, I had time to reflect on life, and I put life on the back burner for so long due to being busy, working a lot. But guess what? You're at home, you're still having pain every day, you're still waking up in pain, and you have an office here that practices the CDC guidelines where you will feel safe. And so there's no need to continue to be in pain. We don't want you to be at home in pain. You can come here. You will be safe here. We also have it to where if we do have multiple patients in here at one time, they are more than 6 feet apart. Or if you want to be even more comfortable, you can sit in your car and wait until we're done with that patient, and you can come in once that patient walks out. So I understand COVID has everyone scared, and you have the right to do that. But I also want you to know that we are practicing the CDC guidelines, and we want to treat you and get you better so that you can still have a good quality of life. Because at the end of the day, we only have one life, and we don't want you to live that in complete fear, but just know that you're gonna be safe when you come to Royal Blue, from the time you walk in to the time you leave, and you'll be calling us wanting to come back just to come back.
Thanks, Laquan. The next topic is one that you may not feel comfortable discussing with your family or friends, but the fact is that aging increases the risk of many kidney and bladder problems. Please welcome Georgia native, Dr. Neil Patel, urologist and surgeon from Advanced Urology.
My name is Dr. Neil Patel, and I'm a urologist, chief technology officer, and director of robotic surgery at Advanced Urology. I was born and raised here in Georgia. I grew up in a town called Monroe, Georgia, and grew up and went to school in Athens, Georgia. Once I finished high school, I went to Chicago for undergrad and medical school. I went to New Jersey for residency training in urologic surgery. And then I went to University of Southern California in Los Angeles to learn advanced robotic surgery, oncology, and laparoscopic surgery. And what I realized the most after being all over the country, whether it's Chicago, New York, or LA, is that there's no place like home. And that's why 3 years ago I decided to come back to my hometown and provide care back to the community that I was raised in. What brought me to Advanced Urology was the fact that I wanted to be close to home, and I found that this practice, out of all the other practices that I've experienced or looked at in the country, was the practice that provided the best quality care to patients. They provided a good experience, and they used the latest advances in urologic technology to provide the best possible outcome. Many people may ask what urologists do. Well, we take care of the daily ability to be able to pee. You'd be surprised how comfortable people get with being able to urinate every day, and then one day they can't, and that's a big problem. And so we specialize in bringing good quality of life back, because you'd be surprised how much your bladder has a control over your life. But not only that, we take care of bladder leakage. A lot of men and women as they get older think that leakage is just a normal part of aging, and it is not. We also take care of all types of urologic cancers, which include prostate cancer, kidney cancer, bladder cancer, and testicular cancer. It is very important to make sure that you get screened by your primary care physician or see a urologist on a yearly basis to make sure that you don't have any of the signs of these types of cancers. More importantly, September is Prostate Cancer Awareness Month, so make sure you talk to your primary care physician or see a urologist and ask to be screened for prostate cancer. Most of the urologic issues are affecting your quality of life. If it's not peeing, it could be erections, it could be sex drive. There's a lot of things that we are embarrassed to talk about with our friends, family, and our primary care doctors that is normal to talk to about with a urologist. So don't ever feel like whatever you're experiencing is a normal part of aging, because we can always do many different things. What sets Advanced Urology apart from other practices is that we put patient experience first. I believe that when you come to see a urologist, you're almost always dealing with a very sensitive issue, and you need someone who understands the nuances of those issues. We employ the most latest advances in technology and diagnostic workup to make sure that we fully understand the process, and we spend a lot of time educating you on the disease processes, from drawing on the board to personal phone calls to follow up with your entire care team, whether it's your primary care doctor or your referring doctor. We try and bring everyone together as part of the team so that you can get the best possible outcome for yourself and to get back to a sense of normalcy in your life. What you can expect when you arrive at Advanced Urology, the first thing you'll notice is that our front desks are open. We do not have glass or barriers between you and our staff. You will always see a smiling face greeting you when you walk through the door, and they will be there to make sure that your experience is as great as it can possibly be. I believe that the number one thing that we can do for you is to show you a smiling face when you walk through the front door, because that's usually half the battle. The main services that are offered by Advanced Urology include not only top-notch physician care, we have every fellowship-trained specialty within our practice, so almost all cases, whether they are simple or complex, are treated within our network of physicians, surgery centers, and hospitals. We offer the latest and greatest in technology, which includes micro-ultrasound 3D fusion prostate biopsies for patients who may have an elevated PSA and are concerned about prostate cancer, to our own Da Vinci robot, where we can do outpatient robotic surgery at our surgery centers. This allows us to provide better outcomes at a better value at a lower cost to the patient. And with those technologies, it's just naming just a few of the things that we do that will help provide better outcomes for the patients. At Advanced Urology, we are up to date with all the latest technology. We are the only practice in the Southeast that has 3D micro-ultrasound MRI fusion biopsy machines through a company called ExactView. We are also the first practice in the country to offer outpatient robotic surgery outside of the hospital. We involve and utilize advanced technologies in the clinic, including state-of-the-art endoscopy that we can do in the clinic and in the surgery center. We have the most advanced laser machines for kidney stones. We are always pushing the envelope, and we are always being approached by the leaders in the field of urology to use their technology and provide feedback and testing. And I think that that makes us one of the few practices in the country always on the forefront of technology. And that is immensely huge, specifically in urology, when we're dealing with people's issues with urination, with kidney stones, with cancer, the whole gamut. The work culture at Advanced Urology is by far one of the most things that we are proud of. We were named an AJC Top Workplace for 2 years running. Our staff are always engaged. We have weekly employee appreciation programs. The one thing you'll ask, if you ask any of our employees what they feel about our practice, is that we have heart, that we're family, and then that matters the most. Everyone comes to work extremely happy. We all hang out outside of work and in work and joke around, and the days go by so quickly because everyone is always having such a great time here. Many people may be afraid to go see their physician during these interesting times with COVID-19, but just know that we are taking every precaution possible to make sure that the healthcare facility is the most safest place that you can go. We do not take COVID-19 lightly, as you know that we don't, and we do everything that we can to make sure that our patients are safe and taken care of for. At the end of the day, we all still have health issues. We still need to get them taken care of. And COVID-19 should not stop us from making sure that we provide you a great quality experience with a great outcome without any additional risk of COVID. That's why all of our facilities have COVID screeners outside in the front, making sure that patients are safe from other patients and from our staff, to make sure that our staff and our patients are healthy so that we continue to serve you. Our surgery centers are all top of the line. They do not have, we have not had any cases of COVID-19 come through our centers. That's due to the major efforts that we take to screen patients, make sure that we have good hand washing, we wear masks, all the things that you would expect us to do. And that allows us to take care of our patients outside of the hospital setting. One thing about Advanced Urology is that we are our own mini health system. We offer in-house laboratory, in-house imaging, and in-house surgery at all of our centers to make it convenient for the patient to get all of their work done in one single location without having to navigate insurances, different locations, different surgeons, different payments. We make it very easy and straightforward for you to get your care done in a facility that's safe, clean, and COVID-free. My final thoughts in regards to advanced urology is that there's no better urologic practice in the Southeast. We take our patients' concerns seriously. We are always trying to provide a great experience. We lose sleep sometimes trying to make sure that we are doing the right thing for our patients and that they are having as good of an outcome as possible. And we just want to continue providing that service to our patients in our community and to the greater good of urologic care. We offer same-day appointments. We even do same-day surgery. If you have patients or you're in trouble and you need to be taken care of that day, we can usually try and make it happen. And most importantly, we take all insurances. There should be no barriers to getting between you and great care. And that's why here at Advanced Urology, we do everything we can to make sure that we are accessible to you. If you want to make an appointment, please call 678-949-5086. That's 678-949-5086. Thank you.
Thank you, Dr. Patel, and thank you for joining us today for Generations Expo virtual event presented by Northeast Georgia Health System. You can view this event in its entirety or watch particular areas of interest starting tomorrow on GwinnettDailyPost.com and over the next few months on GenerationsExpo.com. Be sure to join us next Thursday, September 24th at noon, as we welcome Carol Ann Gelderman, RN and manager of the sepsis program at Northeast Georgia Medical Center, as well as other guests with topics of interest, particularly for those of us who are 50 and above. Thanks again to our presenting sponsor, Northeast Georgia Health Systems, as well as other supporting sponsors and preferred vendors, including Dennison Hearing Solutions, Royal Blue Medical, Fernbank Museum of Natural History, the City of Lawrenceville, Gwinnett County, Love and Florist, Advanced Urology, Aurora Theater, Belk Mall of Georgia, and the Gwinnett Stripers. Watch for door prize winner announcements at the end of this event. You could be the winner. See you next Thursday. Don't miss the Generations Expo 50-plus Boomers and Senior Virtual Event presented by Northeast Georgia Healthcare System. Experience informative sessions about heart health, sepsis, joint health, how to identify signs of stroke, hearing health, and more, as well as how to safely manage preventative care and seek treatment in today's world. September 24th at noon. Register today. Register on GenerationsExpo.com.
NGMC is committed to caring for all patients, regardless of their ability to pay, so they don't have to leave our community to find care. Just last year, we provided more than $40 million in financial assistance to those in need. Choose community. Choose NGMC.